For example, if a patient would come to see us in the clinic for the first time, is when we spend more time than we typically would with patients, and we go through a detailed description of their clinical history. Really, clinical history is the most important element of the data and the information that we get to be able to generate a diagnosis. And this would involve different elements of people's history. First of all, the most recent history, why they came to see us in the very first place. And then we look at that part of their history over a longer period of time. For example, people come to me with swelling in their legs, and so first of all I ask, what is it that brought you to see me on this particular occasion? When was the first time you developed swelling in your legs? To take a more in-depth history. We'd also talk about elements of high blood pressure, elements of diabetes, the control of those diseases over the last few years as well. And so when people have advanced eye disease or neuropathy from diabetes, it's likely they're going to have some element of kidney disease as well. In addition to that, we take a thorough history about other parts of the body, like the heart, for example. It's good to know elements of heart disease that they may have had, or blood vessel disease in other parts of the body. And so if people have had gangrene in the toes, for example, that's very important for us to know that there's damage to blood vessels in certain areas of the body, because there could be damage to the blood vessels in the kidneys too, of course. We would then ask about specific symptoms they would have, including swelling in the legs or swelling in the body, trouble breathing because of too much swelling in the body globally, which could be a feature or manifestation of kidney disease. Would ask about certain specific symptoms of kidney failure, which I believe we're going to go into in more detail later on. Would also take a thorough past medical history to really incorporate any disease which people have had throughout their entire life. And this can be certain diseases which may not seem to be relevant, but which may actually be very relevant, like psoriasis of the skin, for example, could be related to the kidney disease that people would have, or vitiligo, for example. And so there's many different elements to the past medical history we need to know. A detailed medication history as well would be very important, including over-the-counter medications, because again they can exert influences over the kidney function, and potentially cause kidney damage as well. Of course, allergies would be important to know. People's family history can also be related to a lot of different kidney diseases as well. Not all of them necessarily, but it is important to know, especially if there's any specific kidney diseases in the family, or even other diseases that would affect blood vessels or the immune system and so on. So in terms of the social history, it's important to know all the elements of people's social history. For example, smoking causes a lot of damage to blood vessels. It's important for us to know that if there's any way to help people to stop smoking. Alcohol use or recreational drug use is also incredibly important for us to know as well, because again it can impact health in different ways. People's profession is also very important for us to know. It may itself play roles in terms of certain chemical or radiation exposures that people may have, i.e. people who've been in the military may have had certain radiation exposures, which would be important for us to know. Engineers or people working in chemical plants, for example. After that, we would tend to do a physical examination. This would include measuring someone's weight, as well as basic vital signs, and this will either be done by the physician or by one of the medical assistants, including checking the pulse, the blood pressure, the temperature, those kinds of parameters. After that is going to be a physical examination. Typically we don't do an examination that would strip patients off. It would be listening to the lungs, for example, listening to the heart, palpating the abdomen, trying to palpate the kidneys as well, listening for bowel sounds, examining the extremities as well. So that would be the typical examination that we would do, but we don't take patients' clothes off or anything like that. After that is typically a discussion of what we have subsequently found and what our determination would be in terms of the diagnosis that we believe is happening at the time, and then a management plan going forwards. That management plan is going to be a discussion of the various tests that we may need to do to move forward to get to a specific diagnosis. And these tests can be from simple blood tests or simple urine studies, certain imaging studies like ultrasound scans of the kidneys, and from time to time we may even need to do biopsies of kidneys. This would be generally what we would do in terms of testing. We will then discuss certain changes to the medication that people are taking, either changing medication which they're already existing or introducing new medicines. After that, we'd also talk about different things to avoid in terms of certain medication exposures, certain food groups or certain diets that people may need to adhere to as well. There may be some educational material that we could provide for patients, i.e. if people had recurring kidney stones, we could direct them as to the correct diet. And so we may give them handouts for foods which are low in oxalate, for example. And so there would be a variety of different educational materials available, depending again upon the clinical situation. After we make the plan, we would then plan to see each other for follow-up at a certain point in the future, whenever that follow-up would be appropriate to be.